My name is Steph. I'm an occupational therapist from the Step Care Therapy team, and that's a part of the Cambridgeshire Peterborough NHS Foundation Trust. What's it like to work in my team is it's a really multidisciplinary team. So we've got a team of psychologists, we've got a CBT therapist, we've got myself as an occupational therapist and an occupational therapy assistant. So it's really fantastic to have a multidisciplinary team, so really bounce off each other and get ideas from each other on how we can best provide the care for the clients that we see every day. What a typical day looks like for me is I tend to go to the office, check all my emails, do some of my admin and prepare for when I go out and see my patients. I then tend to do 3 to 4 home visits a day. So a lot of my patients either have anxiety, depression, trauma, and or dementia. So as an occupational therapist, it's really important that we are working with not only the individual themselves, but also the stakeholders involved. So for some of the patients, that may be their carers, that may be the people in the care home. So really trying to build the knowledge and the capacity of care home staff to make sure that they're best supporting these individuals. So what I would do is go out and work with these patients on whatever they see is meaningful and purposeful, try and increase their occupations and their overall quality of life. After each session, you come back, and because of the flexible working arrangements, you can work from cafes or home, and you can get all your progress notes done, which is fantastic. So since starting at the Trust, they organised for me to have a work car, which I then use to go and explore all of Peterborough. So Peterborough is a mix of urban and rural places, so it takes you to some really interesting and some really beautiful parts of Peterborough. It's really fantastic doing the mobile work, although at times it can be challenging with trying to be organised and getting your admin and your progress notes and things like that in. It's also fantastic because you really get to see the patient doing the occupations in their particular environment. It allows you to really kind of see what are the barriers to them achieving these particular occupations, and you're able to get there and intervene within their own space. Something that I really like about this job is not only the fact that I get to give back to people who are really in need and are extremely vulnerable, but also the fact that they are so grateful for you to be a part of their support team. They really appreciate you, they're very thankful, and they give you that positive feedback. I know sometimes in healthcare you don't get that, but in this job you really do feel appreciated. So if I have any advice, I would say take the adventure. It's definitely the best thing that I have ever done, and working with the NHS has given me the flexibility to not only explore within the UK, but also all the other countries that Europe has to offer.